In your health edge, when it comes to fertility, the belief that a woman's age is all that matters when a couple tries to conceive may be wrong. Men also have a biological clock, according to a study. Out with us this morning from St. David South is reproductive urologist Dr. Parviz Kavusi. Dr. Kavusi, tell us about this study. Thanks for being with us.
No, thank you for having me. So this is a study that's come out of Colorado, and it's actually an animal study. So they're looking at a mouse model, which is a pretty good model for the human biology. And what they looked at was they took male mice that were at their midlife stage. So that's about equivalent to 45 to 50 years of age in humans and men. And they looked at these 13 mice, and only one of them was able to actually achieve a pregnancy with their female counterpart. So the question has arisen again, is a man's age as important for a couple's fertility as a woman's age is? Of course, an animal study is not perfect. We need more translational research that's done in the human model to give us a better understanding. However, there are a lot of studies actually out there about what we call advanced paternal age, when the man's age is considered a bit higher for achieving a pregnancy, and what the effects may be. The issue is that the jury's still kind of out, so we're not quite sure yet because the data's not that robust, and there's a lot of contradictions in the data. There are some studies that say, yeah, we certainly see parameters going down as men age and fertility getting worse as men age, and then there are other studies that show there might be some diminishment in numbers, but it isn't a very significant effect on that couple's ability to conceive. So we're not quite sure yet.
What do you see in your practice? You hear about women in that age and that, you know, you need to go ahead and have that baby or do something, but what do you see? It's not, men can also have problems too.
Absolutely. So first of all, overall, just societally, we're seeing that couples are waiting longer to have children than they used to in the past for all sorts of reasons. So we're seeing couples that are considered in the more advanced age category all the time on both sides. I think the key of studies like this are to remind us that fertility is not just a woman's issue. This is the one thing in medicine that takes two people to be successful in getting the outcome that we want. So really the focus needs to be on couples. We see that 20% of couples that we consider subfertile, having some trouble conceiving, have solely a male factor reason that the couple's having difficulty. There's an additional 40% where there's male factor plus female factor. So when you do the math, that means 60% of the time there's male factor involvement when a couple's having difficulty conceiving. And traditionally, and unfortunately still in a lot of places, we tend to ignore the guys and just focus on the women, where we can be getting better results and perhaps offering more options if we're evaluating both sides of the couple.
And there are things you can do, that surgical and non-surgical.
Absolutely. So there's hormonal treatments, there's medical treatments, there's surgical treatments, there's lifestyle modifications, there's all sorts of things that we can do. We can get variables out of the equation sometimes that are having a bad effect on a man's fertility to help that couple conceive in a way that they see fit. So we try to offer the entire spectrum of treatments from very minimal, easy things all the way to the highest levels, most advanced treatments, and let that couple work through that together to see what's going to fit them best once we figure out what options are viable for them.
And make it easier to bring that bundle of joy into the world. All right.
That's our goal. That's why we love going to work every day.
All right, doctor, thank you so much for being with us and sharing your insight. We appreciate it.
Thank you for having me.